January 24th, 10:15-ish, House Healthcare. And this morning we are just going to do a walkthrough of H35 and have committee discussion. It is my intention that we can vote on this today, although I will say that we have a couple members who are testifying in other committees, and I'd like to hold the vote until they're all back here. So we might be going on a break until then. So Jen, do you want to maybe put up the language?
Yes. Good morning, Jen Carby from the Office of Legislative Counsel. We are looking at H35, which we looked at a few days ago, and I think you've heard from some folks since then. So let's just remind you what's in here. This is an act relating to unmerging the individual and small group health insurance markets. As you may recall, there is a lot of cleanup in here before we get to that part. So section 1 is the first of a few different sections making this same cleanup change to have the definition of qualified employer for purposes of the Vermont Health Benefit Exchange, what you know as Vermont Health Connect, be an employer. Qualified employer is an entity that employed an average of not more than 100 employees on working days during the preceding calendar year and meets certain other criteria. This is cleanup because that number changed from 50 to 100 employees in 2016. And so this is really just taking the pre-2016 references out of the statute. So that's the change in section 1, same change in section 2, which is a section just unqualified employers. And again, taking out the references to the pre-2016 version and to that date and just having that language set going forward until you make other changes.
Do you want us to interrupt you, Ken, while we're doing that?
That's fine with me.
I just have one question.
Sure.
In the statement of purpose, it says the bill proposes to unmerge the individual and small group. It's already done, isn't it?
It has been done on a 1 or 2 year temporary basis.
Should we say permanently?
I mean, they are still technically merged. This is the statement of purpose of the bill as introduced. So it is, so yes, if you want to describe it to people, you could describe it as permanently unmerging because the statute was never changed. I just described it as unmerging. But the statement of purpose of the bill as introduced will no longer be necessarily riding with the bill after it leaves the committee.
You have a burning desire to.
Well, you can't amend a statement of purpose. It's the statement of purpose of the bill as introduced. So you could have said permanently. I didn't say permanently because the statute was never changed.
Okay.
But you're right. What it does is permanently with, always the little caveat that unless the legislature merges them again or does something different. All right, section 3 is the duties and responsibilities that DEVA has, the Health Benefit Exchange, but really DEVA operating Health Benefit Exchange has under the Affordable Care Act. And so these, again, were some changes to reflect, in some cases, just clarity. So in number 7, the current law says providing to the U.S. Treasury the name and taxpayer ID of each individual who was an employee of an employer but was determined to be eligible for a premium tax credit for certain reasons. This is taking away that where that who was an employee of an employer part and saying, and so it would be each individual deemed to be eligible for a premium tax credit. That's the information they actually provide as required. And that includes anyone who is an employee of an employer but was still deemed eligible for a premium tax credit. Number 9, in existing law, there's a duty to transfer to the Treasury the name and taxpayer ID of each individual who has notified the exchange that they've changed employers. That sounds like is not information that they have ever collected or collect now. And similarly, they do not communicate to employers the name of each of its employees and the effective date of cessation reported to the Department of Treasury. That's just not a communication that is required or is occurring. Establishing procedures under existing law, there's a duty that specifies the procedures would include payment mechanisms and standard fee or compensation schedules that allow licensed insurance agents and brokers to be appropriately compensated outside the Navigator program for helping people sign up for coverage. It's my understanding this was connected to the small business exchange that was never established in Vermont and never stood up. So this is not something that they have done or are required to do. But they do have procedures allowing agents and brokers to assist people with signing up for exchange plans and for applying for assistance. Section 4 is when we get to the health plans themselves, and this is where some of the language in here, some of it is continuing to make these cleanup changes, but this is where we actually get to the pieces that specify the unmerged market. As I mentioned, the first time we walked through the bill, there was nothing very overt in the existing law that says the markets are merged. That's how the language permitted that, and that's what was done, but there's nothing where I can simply strike through merged and say unmerged. So it's a little bit more nuanced than that. So we have first the definitions, and I've tried to incorporate some changes in here that clarify that the separate markets. So in health benefit plan, down on lines 5, 6, and 7, got a reference to individuals in the individual market and small employers in a small group market. Then on page 7 in subdivision 3, this again is that cleanup language, getting rid of the outdated references to the pre-2016 definition of a small employer. Just a stylistic change on lines 17 and 18 to be consistent with our drafting style. Then in subsection B, we'd had language in the statutes enacted a few years after the exchange started, once it was clear that we could allow individuals to purchase plans directly through the carriers and not just through the exchange. So we first put this language in. There was the caveat that was to the extent permitted by the U.S. Department of Health and Human Services. It has become an established part of what we do and is permissible by the federal government. So we don't need that language anymore. And similarly, it wasn't clear if that's something that the carriers were going to pursue. So it said if the carrier elects to make direct enrollment available, we've taken out that language. And so this now continues to allow people to purchase, an individual to purchase through the exchange website, through navigators, by telephone, or directly from a carrier who contracts with the exchange. Similarly, in subdivision 2, again, taking out that caveat about to the extent permitted by the federal government because it is permissible. And this language currently says that a small employer or their employee can purchase a plan through the exchange website, through navigators, by telephone, or directly from a carrier. The exchange has been implemented over the last several years. The employers and their employees actually only buy directly from the carrier. So this is taking out the references to them purchasing through the exchange website, through navigators, or by telephone. Although navigators could certainly still help them identify how to purchase through the carriers. In subdivision 3, I've just added a couple of words here to try to, again, paint that difference between between selling a plan to an individual or to a small employer. This by itself, I wouldn't say is sufficient to accomplish that unmerging, but taken with everything else, I think it supports. Same thing in subsection C. The carriers have to register. All right, so then we get to some of the more specific unmerging language. So first we have guaranteed issue, and under current law, carriers have to guarantee acceptance of everyone who applies for a plan. So all individual small employers and employees of small employers and their dependents. I've separated this out into 2 subdivisions. One saying a registered carrier shall guarantee acceptance of all individuals and their dependents for any health benefit plan offered by the carrier in the individual market. And again, it maintains that regardless of any outstanding premium balance from a prior year. And then we have a separate subdivision saying the same thing, but specifically for small employers and the small group market. So a registered carrier must guarantee acceptance of all small employers, their employees, and their employees' dependents for plan offered in the small group market. And again, regardless of any remaining outstanding premium balance. Then we get to another piece that further separates these, and this is some of the practicalities of what it means to have the separate markets. This has to do with community rating. This is how the premiums are determined for these plans. And this directs carriers to use, same as under existing law, community rating method acceptable to the Commissioner of Financial Regulation for determining the premiums. And then it specifies that the carrier shall determine the premiums for the carrier's individual market plans separately from the premiums for its small group market plans. And this is how you can end up with, as you've heard from some of your other witnesses, with people in the small group having premiums that reflect the experience of that group, while the individual market people might have higher premiums on paper, but be eligible to receive financial assistance through subsidies and tax credits. All right, and then we just have a change to some non-gendered language. And then finally, in section 5, the effective date, the act would take effect on January 1st, 2026. That's the beginning of the 2026 plan year. And the existing temporary unmerging provisions run through the end of this current plan year, which is plan year 2025. So this would have it be a seamless continuation of the unmerged market.
Thank you. Anyone have any discussion about what we're doing?
I do.
Yes.
So this was originally slated to end on February 28th.
January or December 30th.
This would end at the end of December of this year, the unmerged market.
So it had to be done before that date, that just to have it on paper, or could we just I guess I just don't understand.
So they're currently unmerged.
Mm-hmm.
That unmerging ends December 31st of 2025.
Okay.
So if we do nothing, it goes back to being merged again.
Okay.
Right, and the carriers are working on their rates, developing their rates and going through the full rate review process with the Green Mountain Care Board this winter and spring.
Okay.
And so they need to have the premiums set, and they need to know what the market is going to look like that they're setting those premiums for.
Thank you.
Yes.
Brian?
Yeah, I was just gonna say, and we structured it this way. What in the past committees structured it this way because we wanted to see where things were gonna be at now. But it's clear, I think, that if we don't do this, it's gonna have greater harm than if we take a chance. And so I support this. And the only thing I would ask is that over the course of this session, we make space for the public to weigh in on their experiences with the healthcare system and its expenses, and maybe have like a public hearing or something at some point. I'm not asking us to commit to that now, but just because one aspect could be people weighing in on how it actually plays out for them. And the other thing is the other pieces of the healthcare system and how it's working for them. That's a different topic.
Yeah.
Yes. Yeah. But this is part of it, being the cost. So I support it.
What do you think?
Just curious, the costs involved. This benefits the individual markets. Will it benefit the small market? Will there be
It's actually a
cost?
bigger benefit to the small group market than it is to the individual market.
Okay,
By pulling out, so the individual market typically has higher premiums because people who are not getting insurance through their employer often tend to be people who are more costly to insure. That's just the sort of general experience. And so when we have the markets merged, the costs for the more expensive individual market is spread across both the individual and small group market, which makes the small group premiums higher than they would likely otherwise be. So by pulling out the individual market and having it rated as its own pool, and the small group market rated as its own pool is expected to reduce reduce the growth in premiums for the small group. The individual market premiums may go up across that category of individual market, but those people are eligible for, many of those people are financially eligible for advanced premium tax credits and or cost sharing reductions that are available through both state and federal law.
So if we were to merge them back, the small group would then be put back into the
Right, they're unmerged now.
the higher rated. And so in addition to what is seemingly sometimes the annual increase in premiums, it would jump up even further because they would have to take on the risk of the individuals.
Without the benefits that the individuals can get.
Yeah,
And our insurance companies are favorable for this. Well,
No one has, okay, let me ask you this.
yes.
We, like 48 hours ago, we did a last call for opposition. There's been no opposition, right?
There's been no opposition. I received no communications from anyone. I don't believe our committee assistant has received anything to the committee.
Yeah.
And I think we heard around the table from, the people who represent everyone that this affects, that this would be
The way they wanna do it.
the way that they want to do it. Yes.
My question, I never worked in the small business, so I just have a question if anyone knows the answer. The employer has to offer it to, and I read that one part about offering it to the employee and their families, the dependents. But
I'm not sure they have,
No,
yeah, I
they
don't
don't.
think they have to.
Did you see?
If they offer it,
Is that
Right,
what
it's
it
really
said?
talking about if they're, yes, I don't believe there's any requirement to offer family coverage. You can offer just to the
Okay.
employee and not their
That's
dependents.
what I thought it was, and wow, they're gonna make their.
Yes.
However, and I believe that if the, and Jen, you can correct me if I'm wrong, but if the employer doesn't offer it to the family can then go to the exchange and they're eligible separate from the person who's covered.
well, they can go right directly to the insurance company too.
True.
But if you go to the insurance company, you do not get financial assistance if you're eligible, so
Yeah, yeah.
you'd be better off to go to the exchange.
That's fine. Yeah.
And they'll always ask when you're doing it online, whether or not you have coverage offered through any ESI.
Right, exactly.
So to sort of answer her question, and maybe Jen, you can clarify in case so the way it reads now, because we're cleaning up, if you purchase through the exchange, they must, if you want, pay or insure your dependents as well. But in this section where it's now talking about a small employer, it just says may.
So it's all about
Offer to
guaranteed
individuals.
acceptance. So it's not that the employer, it's not talking about who has to be offered the insurance, but if a small employer is offering a plan to their employees and their employees' dependents, the plan can't say, no, that person has high health costs, we're not accepting them on the plan.
Okay, thank you.
That's really what the guaranteed acceptance is the insurer does not get to say no to somebody who is eligible.
Thank you.
For now, anyway.
Why do you say that?
Okay.
Okay, any other thoughts, comments, clarifications? All right,
Do we know where Penny is?
yeah, I think he's due back here at 11, so I think we're gonna take a break
Mhm.
until Penny gets back, because
Yes.
I know he wanted the opportunity to vote on this, so.